When I was a brand new ICU nurse, I remember coming home after shift so overwhelmed I could barely function. I was exhausted, anxious, and constantly second guessing myself. I knew I needed support, but trying to find a therapist who took my insurance felt impossible. Every option I found was either out of network or had a wait list months long. That's why I'm such a big fan of Rula, Rula. Rula is a healthcare company that makes it so much easier to find a therapist who takes your insurance, with sessions as low as $15. And instead of just matching you with whoever's available, Rula connects you with someone who fits your needs, goals, and preferences. Appointments are available as soon as tomorrow, and they'll walk with you every step of the way to make sure your care is actually helping. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget. Well, hello. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Today, we are getting ready for the NCLEX, y'all, and also just for any old rando nursing school exam, because I am going to be doing a pod quiz with you today. So if you're not sure what a pod quiz is, this is essentially where I ask a question and then I pause for a little bit to give you time to answer and then tell you the answer. It's basically like doing flashcards, but with your ears. So instead of sitting and staring at a darn screen, you can get up, move around, go for walks, unload the dishwasher, do the laundry, which is the thing that's hanging over my head today. You can basically get on with your life and still review. I used this method when I was a student, and I'm telling you, it 100% changed how I studied and how active I could be. I started going for walks and runs in the park and still felt like I could review and do all those things that I also knew were really good for me. And this is echoed by our listener shout out this week. This one goes out to a person who goes by the name Dogs Over People, who says, I am forever thankful for you, Nurse Mo. I found your podcast when I was taking prerequisites for nursing school. Later, I took your boot camp to prepare for my program. Your podcast and Study Sesh allowed me to enjoy walks with my dogs without study guilt. You have a wonderful way of breaking down complicated topics into digestible information. I wanted to share the happy news that I passed my NCLEX. I'll be sure to keep listening to your helpful content in my new grad journey. So, Dogs Over People, thank you very much for that glowing endorsement of how using the podcast and Study Sesh can help you kind of get your life back, still do the things you love, but you're also studying without having any guilt. So I'll put a link in the episode notes to Study Sesh so that you can check it out. So if you really want to see how it works, let's get started. So for this to be as realistic of a comprehensive review as possible, I'm just going to grab topics from all over the place so you'll never know what's coming next. Kind of like the NCLEX. You ready? Let's go. At what rate do the Purkinje fibers fire? Those fibers fire at a rate of 20 to 40 beats per minute. Is this diabetes insipidus or SIADH, syndrome of inappropriate antidiuretic hormone? The patient is showing signs of dehydration, such as tachycardia, hypotension, and dry mucous membranes. So it's that DI or SIADH. That is DI or diabetes insipidus. Which form of calcium is physiologically relevant? That's going to be your unbound or ionized calcium. You may also refer to this as free calcium. How much does blood pressure drop with orthostatic hypotension? And name both the systolic drop and the diastolic drop. So it will drop 15 millimeters of mercury systolic and or 10 millimeters of mercury diastolic. Your patient has H influenza. What type of precautions will they be on? Your patient will be on droplet precautions. Very good. What can the drug levodopa do to the urine? Levodopa can turn the urine like a darker color or kind of a reddish color. Your patient has a stoma, but it appears purple in color. What's going on? What this typically means is that circulation to that stoma has been compromised, and you need to let the physician know right away. If your patient tells you that their right shoulder hurts after they eat fatty foods, what might this be related to? So, this could be referred pain from an inflamed gallbladder. Very good. Which is absorbed more quickly, a medication administered intramuscularly or a medication administered subcutaneously? Which one is absorbed more quickly? The intramuscular injection, and this is because there's more blood flow in muscle than there is in subcu tissue. Hepatic encephalopathy is mainly due to the buildup of which waste product? Ammonia. Your patient is taking antipsychotic medications and complains of a sore throat and flu-like symptoms. Why are you very concerned about this patient? The reason you are very concerned is that this could be a granulocytosis, which is a very, very serious adverse effect of some antipsychotic medications. So this patient needs a white blood cell count right away and is at very high risk for severe infections if she does have a granulocytosis. Your patient has an acid-base imbalance. Are they going to compensate more quickly via the respiratory system or the renal system? The respiratory system allows for much quicker compensatory efforts, and the renal system takes quite a bit longer to kick in. How should you position your patient after a lumbar puncture? You want to place this patient in a supine, flat position, and we do this to promote clotting at that site and to prevent or avoid a CSF leak. True or false, your patient is being treated with magnesium sulfate for preeclampsia, and they state that they feel chills. This is a normal finding and should pass quickly. That is false. The patient is actually more likely to report feeling hot or flushed with a magnesium infusion. What are the 4 most common causes of postpartum hemorrhage? And here's a hint. It's the 4 T's. So the 4 T's are tone, tissue, thrombin, and trauma. So tone refers to the tone of the uterus not contracting properly. Tissue refers to retained placental tissue. Thrombin refers to the patient having a coagulopathy, and trauma involves a laceration as part of that birth process. Define a normal Babinski reflex in a newborn. So when you touch along the bottom of the infant's foot, the toes fan and extend, and that is considered normal in a newborn. Not so normal in an older individual because we will test for Babinski in neurological injury, and if it occurs later in life, it's considered very abnormal. True or false? Children with a cleft lip and or cleft palate have lower incidence of otitis media. That is false. These children actually have a higher incidence of otitis media or ear infections. Your patient has renal failure and hyperkalemia. That is not ridiculously high, but it is elevated. What treatment do you anticipate? So for mildish hyperkalemia, that's often treated with K-exalate. If it's a bit more severe and we need to get that potassium level down more quickly, we can use insulin with dextrose, and in some cases, the patient may just need dialysis. But for mild hyperkalemia, a very common medication is K-exalate. What does an Allen's test determine? An Allen's test determines if the radial and ulnar circulation are adequate, and we do this before we do a puncture in the radial artery, which is how we get an arterial blood gas. And you'll see the person performing the arterial blood gas puncture do this Allen's test before they actually puncture that radial artery. Rust-colored sputum is often seen in which communicable disease? Tuberculosis. Your patient is on peritoneal dialysis and the output is looking cloudy. What is this a sign of? This is a sign of infection. What medication is a reversal for heparin? Protamine sulfate. What condition is a Nissen fundoplication used to treat? That procedure, the Nissen fundoplication, is used to treat severe GERD. In what condition is the baby at risk for developing a megacolon? Hirschsprung's disease. In transposition of the great arteries, the aorta exits from the right ventricle. Excellent. Your patient has hyperemesis gravidarum. Are they at risk for alkalosis or acidosis? They are at risk for metabolic acidosis. What degenerative neurological condition is associated with dopamine deficiency? That is Parkinson's disease. What type of respirations are occurring when the breathing gets deeper and faster, and then there are periods of apnea here and there? That is Shane-Stokes respirations. What medication, which is an osmotic diuretic, is commonly used to treat cerebral edema? That is mannitol. Your patient has vertigo, but they also have closed angle glaucoma. What would be the significance of knowing these things about your patient? This is because a medication used to treat vertigo, meclizine, should be used very cautiously or not at all in a patient with closed angle glaucoma. Which type of meningitis has a high mortality rate? Viral meningitis or bacterial? That is bacterial meningitis. Name 2 or 3 causes for autonomic dysreflexia. So some common causes are a distended bladder, fecal impaction, tight clothing, or cold stress, which is why if your patient is showing signs of autonomic dysreflexia, the key thing you need to do is find out what is triggering it and remove that trigger. In what disease condition are you likely to see Kussmaul respirations? Kussmaul respirations are common in metabolic acidosis, and a common condition that is metabolic acidosis is diabetic ketoacidosis. So you'll see your Kussmaul respirations in that condition quite often. What is a normal PaCO2 on an ABG? That normal range is 35 to 45 millimeters of mercury. Your patient is just starting on methylphenidate. What time of day do you want to advise your patient to take this medication? We'll want to teach that patient to take it early in the day because it does cause insomnia. Your patient has pancreatitis and they're getting some labs drawn. What do you expect to see with amylase and lipase? You expect to see elevated amylase and lipase with pancreatitis. Your patient has both hypothyroidism and GERD. What do you need to teach them about their medications? You want to teach them to avoid taking their levothyroxine, which is for their hypothyroidism, and their antacids together. These two medications should not be taken together. What is a typical pressure setting for a wound vac device? Typical is negative 125 millimeters of mercury. As carbon dioxide levels in the body increase, does this trigger the body to increase or decrease the respiratory rate? It's going to trigger faster breathing, so an increase in the respiratory rate, and this will help blow off that excess CO2. Name 2 ideal locations for intradermal injections. One is the inner forearm, which is probably where you get all of your tuberculin skin testing done, and the other is the upper back. You'll often see this done with allergy testing. Your patient had a thyroidectomy. What electrolyte imbalance are you a little bit concerned about? Now, this will depend on if the parathyroid gland was also removed, and if it is, then you are going to be concerned about hypocalcemia. What are 3 signs of digoxin toxicity? Three common signs of digoxin toxicity are bradycardia, seeing yellow, and nausea. When looking at heart valve problems, in valve stenosis is the problem with forward flow of blood or backward flow of blood. In valve stenosis, there's a problem with the forward flow of blood. You would get a problem with backward flow in valve regurgitation. What condition involves a catecholamine secreting tumor that is often located in the adrenal medulla? That is pheochromocytoma. What 2 hormones contribute to water retention? Those are antidiuretic hormone, or ADH, and aldosterone. What do inotropes do? Inotropes are a type of drug. Inotropes increase cardiac contractility. For a dexamethasone suppression test, the patient will get a high dose of dexamethasone, and then what is evaluated next? the ACTH level. And this test is used to diagnose what condition? Cushing's disease. Excellent. Let's face it, when you're a new nurse, or even when you're not, detecting subtle sounds can be difficult. I remember having a hard time hearing lung sounds when I was a new nurse in the ICU. It's a noisy environment, and if the patient is on a ventilator, it can be really hard to discern what's actually going on. Having an echo stethoscope, which has noise cancellation and amplifies heart and lung sounds by 40 times, would have skyrocketed my confidence. Echo combines the stethoscope you already know with enhanced audio and advanced AI to help you detect heart and lung conditions earlier and with more confidence. Here are just a few reasons I'm so excited to be upgrading to an Echo. Echo has built-in AI that helps you detect murmur and AFib earlier. You can even record and share sounds and images with other clinicians for seamless collaboration. Also, Echo helps improve diagnostic accuracy. In fact, those who use Echo are 2 times more likely to detect heart disease. And with Echo, I won't have to second guess myself anymore or approach a coworker to ask them to confirm what I'm hearing. If you want to give your patients the highest quality care, I encourage you to join 600,000 healthcare professionals already using Echo. I trust Echo so much that I worked with their team to create a special offer just for my listeners. Right now, you can get $50 off plus a free customizable chest piece cover at echohealth.com/nursemo. Your purchase could even qualify for CEUs. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. If you don't, return it for a full refund. Go to echohealth.com/nursemo for $50 off plus a free chest piece cover. That's ekohealth.com/nursemo.
Summer's here, and Nordstrom has everything you need for your best dress season ever. From beach days and weddings to weekend getaways and your everyday wardrobe. Discover stylish options under $100 from tons of your favorite brands like Mango, Skims, Princess Polly, and Madewell. It's easy too with free shipping and free returns, in-store order pickup, and more. Shop today in stores, online at Nordstrom.com, or download the Nordstrom app.
Will a hypertonic solution cause water to leave the cell or enter the cell? It will cause water to leave the cell, which is why hypertonic solutions are sometimes used to treat cerebral edema. Bananas, raisins, avocados, and orange juice are rich in which electrolyte? Potassium. How does hypermagnesemia affect the respiratory system? It can cause respiratory depression. What does the medication rifampin do to the urine? It turns the urine kind of an orangey red color. How about the medication amitriptyline? Amitriptyline can turn the urine a blue or greenish color. Your patient has one of these conditions: increased intracranial pressure, cardiovascular disease, or glaucoma. What would you teach them about bowel elimination? You want to teach them to avoid straining, so they should take measures to avoid constipation. To take a tympanic measurement in a toddler, how are you going to position the ear? You'll pull the pinna down and back. What condition can result if aspirin is used in young children? Reye's syndrome. What is yellowing of the sclera called? The medical term for this is icterus, and you'll often see this in jaundice associated with liver disease. What is Turner's sign? That is an ecchymotic or bluish discoloration at the left flank. What condition is Turner sign associated with? Pancreatitis. What is it called when your patient mimics another's statements or movements? That is echopraxia. What ethical principle is at play when the nurse fulfills a promise to stay present during the patient's ECT procedure, even though he was unconscious and would never know if the nurse was there or not? That ethical principle is fidelity, which is the act of remaining loyal to the patient and or your duty. Your patient has lithium toxicity. Do you expect decreased, increased, or regular urine output? Most likely you'll see increased urine output because lithium toxicity can cause nephrogenic diabetes insipidus. Your patient's ABG reveals a high pH, a low CO2, and a normal bicarbonate level. What acid-base imbalance is this? High pH, low CO2, and normal bicarbonate level. That is respiratory alkalosis. What type of posturing is occurring when the patient pulls the arms in with the elbows bent? That is decorticate posturing. And what type of posturing has the patient extending their arms, legs, hands, and feet? That is decerebrate posturing. Which one is more ominous, decorticate or decerebrate? Decerebrate posturing is more ominous for more severe brain injury. Your patient is unable to shrug their shoulders against resistance. Which cranial nerve is having a problem? That is cranial nerve 11, the accessory nerve. Which type of glaucoma involves a loss of peripheral vision? That is open angle glaucoma. And which type of glaucoma can have the ICP rising suddenly? Angle closure glaucoma. What does norepinephrine do to blood vessels and what is the effect? Norepinephrine causes blood vessels to constrict, and this leads to increases in blood pressure. What does an indirect Coombs test evaluate for? That test, the indirect Coombs test, evaluates for the presence of Rh antibodies. A child had a recent upper respiratory infection and is now tugging at his ear. What do you suspect? You suspect otitis media or an ear infection. Which medication is going to have a longer duration of effect, heparin or enoxaparin? Enoxaparin. Your patient is taking corticosteroids. Are you going to monitor them for hypoglycemia or hyperglycemia? Hyperglycemia. Also with that, hypertension as well. Corticosteroids also cause hypertension. Your patient is taking warfarin. What lab test will you anticipate being done regularly? The INR. Your patient has absent breath sounds on the right. and tracheal deviation to the left with significant hypotension and decreased SpO2. What do you suspect? You suspect a tension pneumothorax with mediastinal shift. This is an emergency. Get help right away. And last one, which electrolyte do you want to follow most closely for your patient taking furosemide? You want to monitor potassium. Very, very good. So there you go. You just did like over 50 questions covering a broad range of body systems and disease conditions and ages. So I hope that helped you see what it's like to do a pod quiz. And if you're interested in Study Sesh, again, I've got the link for that in the episode notes. And if you're currently studying for your NCLEX, I want to wish you all the very best luck in the world. And if you're looking at your study plan and you're not really sure how long to study or how to organize that, I actually have an NCLEX study plan that I've created that is yours absolutely free. Just go to straightanursingstudent.com/NCLEX and you'll be taken right to that so that you can sign up for that free NCLEX study plan. And it's nice because it's broken out based on how much time you have to study for your exam. So I hope you enjoyed this episode, and I hope that you are enjoying this podcast in general. If you are, I would love if you would subscribe or follow the show and rate and review. That helps other people find the show and helps them become amazing nurses too. I'll see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wished that you had a direct line to your pediatrician to ask all the questions that constantly crop up while parenting? We sure have. That's why we launched the Bites of Health podcast. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. You can tune in while you're making your second cup of coffee or from the school drop-off line. So be sure to tune in to Bites of Health, streaming now.